Hello, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss Lyrica, Cymbalta, and Savella. Are they the right answer for fibro? Since 2007, there have been 3 medications approved by the FDA to treat fibromyalgia, which are Lyrica, Cymbalta, and Savella. All 3 of these medications work with brain neurotransmitters. Lyrica, or pregabalin, was the first one of these 3 approved to treat fibro, and was originally developed to treat diabetic peripheral neuropathy, post-herpetic neuralgia, and seizures. Prior to Lyrica, fibro was primarily treated using first-line therapies such as NSAIDs like Motrin, narcotics like Vicodin, sleep aids like Ambien, or muscle relaxers like cyclobenzaprine. Scientists don't really know how Lyrica works, but it treats pain and functionality by attaching to pain receptors that inhibit the heightened response to pain those with fibro experience. Lyrica also affects chemicals in the brain that transmit pain signals throughout the nervous system, reducing pain and improving sleep. It's suggested to calm overactive neurons and essentially influence the release of neurotransmitters. Cymbalta, or duloxetine, was the second drug approved by the FDA in 2008 to treat fibro. Cymbalta is an SNRI antidepressant, or a dual reuptake inhibitor, which works on the hormones serotonin and norepinephrine, changing the perception of pain. Cymbalta was previously developed to treat depression and diabetic retinopathy. Cymbalta may cause slight stimulation, which could exacerbate your already poor sleep habits, and Cymbalta also treats general depression and anxiety. One theory is that pain from fibro is caused by changes in the nervous system resulting in an increase in pain signals, and also hypersensitivity to painful stimuli. Cymbalta works to calm these pain signals down by increasing serotonin and norepinephrine. So essentially, SNRIs block serotonin and norepinephrine from re-entering cells, resulting in an increase of these useful neurotransmitters in the body, re-establishing a balance. In theory, this process improves the symptoms seen in fibro. Savella, or milnacipran, was approved by the FDA to treat fibro in 2009. Savella also is an SNRI antidepressant and may also cause slight stimulation. Savella is similar to Cymbalta, but increases norepinephrine more than serotonin. The mechanism of neurotransmitters is that messages travel down the nerve cell pathways at the end of the cell and releases serotonin and norepinephrine. The neurotransmitter is released between the first and the second cell, also known as the synapse. When a sufficient amount of the neurotransmitter reaches the second nerve cell, the receptor is activated and the nerve message continues on its way. And then the reuptake occurs, which is really like the mopping up of these neurotransmitters, where the first cell absorbs any of the neurotransmitter that's left over in that synapse, or the synaptic gap. So what just happened here is the exchange of information transmissions, part of which causes pain. When serotonin and norepinephrine are released from the brain, their primary role is to enhance mood. So here the antidepressant function can help to improve the mood. When these neurotransmitters get absorbed back into the nerve cells, they no longer affect mood anymore, often resulting in depression. So antidepressants prevent the reuptake of certain neurotransmitters in the brain, prolonging positive mood and minimizing depression. Reuptake is the process where some or all of the neurotransmitter is actually recycled back to the sending neuron where it came from. Some is common, but when most or all of this neurotransmitter gets absorbed or recycled by the sending neuron, the original message is either not sent or lost, resulting in a chemical imbalance or incomplete message, possibly increasing pain amplification. The chemical imbalance can lead to depression or pain or other fibro symptoms, among other things, and essentially is a breakdown in communication between neurons, including the ones that transmit pain, like in fibro. A reuptake inhibitor then stops the recycling of the remaining neurotransmitter in the synaptic gap, allowing the neurotransmitter to remain in the synaptic gap a little bit longer, and this results in a better chemical balance, completed chemical messages as commonly seen in depression. So the longer the neurotransmitter stays in the synaptic gap, the better the outcome is for you. So which of these medications is right for you? I think, like a lot of medications that treat fibro, it comes down to a trial and error attempt to determine what works best. Your doctor is going to have an idea which one of these to start you on based on your particular symptoms. Many people try all 3 over time and finally settle on one, or in combination with other types of medications. Studies have shown that about 35 to 40% of people will respond positively to one of these drugs. And all three medications cause a laundry list of side effects as well. Since depression is common in those with fibro, it makes sense that one of these medications could provide a dual benefit, treating the pain and the depression. Subsequently, treating depression may alleviate mood, pain, and sleep. To illustrate how potentially complex fibro is, consider this. Every time we learn something, create a new memory, or strengthen an old memory, we create new synaptic connections, altering the structure of the brain and potentially increasing the amount of receptors subject to chemical reactions involving neurotransmitters. So what I'm suggesting here is that when we learn something new, we grow our brain, we grow our neurotransmitter receptors. Not all physicians are willing to prescribe medications off-label to treat fibro. While Lyrica, Cymbalta, and Savella are all approved to treat fibro, there are many other medications which aren't approved but still show efficacy in the treatment of fibro, like tricyclic antidepressants or gabapentin or naltrexone, and so on. So ask your doctor about these and see if one of them is right for you. Thank you.